The report out today in the New England Journal of Medicine says stents, which pry open clogged arteries, may not be as effective in preventing heart attacks and death as previously thought. Researchers from Canada and throughout the United States followed over 2,200 patients who had symptoms of heart disease but were considered stable. Half of these low-risk patients received stents and medication. The other half were given only medication, drugs to lower cholesterol, control blood pressure, and prevent clotting. To the surprise of the researchers, both groups fared about the same. Approximately 19% had a heart attack or died within 7 years. Dr. William Bowden is the lead author of the study.
One of the things that I think comes out of the trial is that actually medical therapy fared surprisingly well. And in the past, I believe medical therapy has been regarded as an inferior treatment strategy.
How you feeling?
Dr. Jeffrey Moses, a New York cardiologist, says you have to look more closely at the numbers to discover when stents are effective and when they're not.
And the lower risk people seem to do best with medicine up front, and the higher risk people seem to do better with stenting up front.
In what patients does stenting save lives?
Stents save lives in patients with heart attacks and near heart attacks.
Though extremely popular, inserting stents has become increasingly controversial because some newer drug-coated stents may slightly increase the risk of blood clots and strokes.
It's very infrequent. It's 1 in 200 to 1 in 500 patients.
The lesson today? We may have more options than we thought in the treatment of heart disease.
So, John, what do people do if they already have a stent?
Well, there's no need to worry. I mean, the study showed people with stenting might not have done any better, but they certainly didn't do any worse.
And if a doctor's recommending to a patient he or she get a stent?
Again, it depends on the situation. I mean, there are basically 3 scenarios for people with clogged arteries. One is you're having a heart attack or a near heart attack, and in those people, it's been shown that stenting saves lives. 2, you have extensive clogging in a certain pattern, and in those people, it's been shown that cardiac bypass actually saves lives. And finally, there's everybody else. And in those people who have stable angina, some clogging here and there, a little bit of chest pain, but you're doing okay basically, what today's study tells us is it's very reasonable in those patients to just try medicine first and see what happens.